Okay guys, so the first thing you want to do when performing a sterile dressing change is you want to check the physician's orders to make sure that you do have an order to perform the dressing change. The next thing you would want to do is introduce yourself to your patient. You can state your name and your title. So for example, I would say, "Hello, my name is Karina and I will be your nurse for today." The next thing you would want to do is identify your patient. You can do this by checking their ID band and then asking them their full name and date of birth and make sure it matches to their medical record. After that, you can then go ahead and explain the procedure to your patient. When you explain the procedure, you can also let your patient know about any unpleasantness they might feel. After educating your patient, you can ask them about their pain. So assess their pain and make sure that they don't have any, or if they would like any pain medication before you perform the procedure to make them more comfortable. After checking pain, you can then assemble your equipment. Make sure that you have everything necessary so you don't have to be going back and forth and leaving your patient unattended. After gathering your equipment, go ahead and provide patient privacy. This is very important to help them with their dignity and giving them a more comfortable space. Okay, now we'll be performing the sterile dressing change. So at this point, I've already checked my patient's ID, made sure I had physician's orders, and now I'm going to go ahead and start the procedure. So the first thing I want to do is I want to drape the client to make sure they're covered so that none of the solution or anything from the wound gets onto them. I will put on one clean glove and begin to pull towards the wound so that it's as less painful as possible. Remove the old wound dressing, toss it in the trash, and then after that I will check for any signs of infection and healing on the wound to make sure it is looking normal. After that, I will discard my gloves and open my sterile package and go ahead and place on my sterile gloves, making sure that I keep them clean at all times, and then I can start to irrigate from least contaminated to most. After that, I will dab it dry around the edges, making sure there's no liquid left behind, and then I can cover it with some new clean sterile gauze right over the wound. Use some tape to cover around it to make sure it doesn't come off. And last but not least, don't forget to initial and time and date the outer edge of the wound to make sure that everyone else knows that it has already been changed and at what time it has been changed. And now you are all done.